America, you've been robbed, and you don't even know it. The health insurance industry is a multi-trillion-dollar industry that's gotten rich off the ignorance of the American public. Most people would rather have their gums scraped than talk about health insurance. But let's take just a second and talk about what really happened. Overinflated costs, increased deductibles, and skyrocketing premiums that today are one of the most expensive items in a family's budget. What kind of country have we become where families and businesses are held captive, forced to pay for insurance under threat of penalty and getting little to no value for the price they pay? It's called an oligopoly, or what I call the healthcare cartel. It's comprised of four elements: big hospitals, big health insurance, big pharma, and big government, in a dastardly plot to hide, confuse, and baffle consumers. When Big Government's Affordable Care Act passed in 2010, it offered insurance to people who had current health problems or pre-existing conditions and put them in the same pool as healthy people. Combining these incongruent groups into the same pool forced the vast majority of healthy people to pay dramatically increased costs, paying for services they didn't need or even believe in, like abortions. Once government-mandated health care happened, premiums shot through the roof, with huge premium rate increases happening every year. Like in 2016, a 118% rate increase in Arizona alone. That's insanity. Now, whether you like Trump or not, he did three things to help Americans reform their own health care by giving the power back to the consumer. First, he zeroed out the penalty for individuals who didn't have insurance and made it impossible for big government to penalize you on your taxes. Second, he incentivized private insurance companies to offer products that were consumer-driven by eliminating that IRS hammer that came with government mandate and encouraging competition. Third, Trump signed an executive order requiring all hospitals, doctors, and clinics to be required to publish their rates. That's right. Now you, as a consumer, have the power to shop for your own health care, and you control how your money's spent. So what's a consumer-driven or reference-based health plan look like? Well, thanks for asking. Okay? It's a kind of a free market solution offered by private healthcare companies that offers a defined benefit. Simply put, it pays money just like any insurance. The difference is a defined benefit plan will pay the doctor, pay the hospital, or it'll pay you. If you have the money, you're in control. Think about it. If you have cash in hand, you might be able to negotiate a better price, which puts the power back in the hands of the consumer. These plans are saving American families 30 to 60% on their premiums each month. For a family of four, savings could be $10,000 a year. Holy premium, Batman! That's like a trip to Disneyland. We aren't saving families a couple bucks. We're changing their financial lives, giving them better access to medical treatment at the same time. Obamacare did a tremendous job of confusing health care with health insurance. Health care is simply your relationship with your doctor. Health insurance is just how you pay for it. And with consumer-based health care, Americans are waking up to the power of choosing their own doctor again, negotiating cash prices, and shopping for the best value for medical services versus being thrown into an overpriced, uncustomizable plan that is literally robbing people of their income. The reformation in healthcare is already here. You have the solution. Now you have to proactively embrace the power through knowledge. We can train you in the ways of the Force. You can become a Jedi like me. We can no longer depend on healthcare cartel to fix the problem because they are the problem. I'm Kent Long, author of The Catalytic Agent, and I'm building a nationwide army of a new breed of health insurance agent. Agents that sell real, workable solutions to clients that control costs while providing better, wider access to quality medical care. Agents that truly understand what caring for people's health is really all about while getting well compensated for it. And it starts by your action. 1, become a licensed insurance agent. 2, get appointed with Catalyst Insurance Group. And 3, engage in our training programs. going to take people like you and me to dethrone the healthcare cartel, and we have a plan to do it. If you'd like to learn more about consumer-driven healthcare and how you can transform people's lives, including your own, join me at kentlong.us and register for a live webinar with me.